We are going to talk about medication errors. First, we're going to talk about the impact of errors on patients. The 2003 IOM report stated that we should educate student nurses so that they graduate with adequate understanding and acceptance of their job, which consists of caring for their patients, but also continuously improving the quality, safety, reliability of the healthcare system. It discussed health profession education, exactly what should be taught to students. They developed QSEN, which is the Quality and Safety Education for Nurses, was created out of this. Types of medication errors. Medication errors do not have to cause harm. There can be no error, although circumstances or events occurred that could have led to an error. This would be what we'd call a near miss. A medication error that causes no harm. A medication error that does cause harm. And then medication error that results in death. Reporting errors prevents errors from reoccurring. It's not a punitive thing, it's a learning experience. We can't fix a potential risk if we don't know about it. So common medication errors, the wrong medication or IV fluid, so giving the wrong med that has a similar name or to the wrong patient. Incorrect dose or IV rate. The pill was supposed to be cut in half. The IV rate was supposed to be slowed down. It wasn't. Wrong client, route or time. So you give the wrong bed you give the medication to the bed patient instead of the door patient. Administering med that the patient is allergic to. Allergy is listed and the med was given anyway. Omission of a dose or extra doses. You got busy and you forgot to give a medication. Could be incorrect discharge of a medication or IV fluid, so you stopped it when you shouldn't have stopped it, or inaccurate prescribing. This is when the prescriber writes down the wrong dose or med and writes it incorrectly. So don't forget all the things that should be on a prescription, okay? All prescriptions should have the name of the med, the strength and the dose, the route, the timing, so the frequency, the quantity to dispense, the number of refills, and then the signature of the physician or the provider. So issues contributing to errors. Errors can occur during any step of the medication process. Procuring it, prescribing it, transcribing it, dispensing it, administering it, and then monitoring for things. Most are a breakdown in the medication use system. Electronic charting has decreased medication errors but created new problems. Now we're overriding allergy alerts or drug interaction alerts. We're clicking on the wrong drug. Always make sure you scan it in so you don't have to worry about clicking on the wrong drug. Always question any issue that doesn't seem correct. If the patient asks why they are getting this med, or they have never taken this med before and don't know why they're taking it, double check with the prescriber. Just make sure. If they question it all, always just double check. Call the provider. Drugs commonly involved in errors are high alert meds, sound alike, look alike drugs because they get mixed up, central nervous system, chemo drugs, and anticoagulants. Use of abbreviations should not be used at all. Ineffective communications. You can't read the writing on the prescription, or you don't understand what they were saying on the phone. Do not be afraid to ask the prescriber to clarify things, because ultimately it is you that gives it to the patient. So there are the rights of medication administration, the right patient. So you use two forms of identification and scan the armband, so name and date of birth. The right route, use different syringes for enteral versus parenteral. So enteral, it means it goes in the GI, so those should be amber colored. Parenteral means it's going in the vein or in the arm. It's an injection of some sort. It should be a clear syringe, the right form, make sure it's the correct strength, right drug, the SoundAlike lookalike drugs. Leave the medication in the package until you're ready to administer it, okay? That'll help prevent any problems. Right dose. Check to see if it's within therapeutic range. You double check the calculations with another nurse if you need to. Prepare a dose using a standard measurement device like a medicine cup or a syringe, etc. Something that has the right measurements on it. You don't just grab a spoon and say, okay, that's a teaspoon, etc. The right time, check with hospital policy, but usually it's given within an hour or 30 minutes of the order. Okay, so if the order says it's to be given at 7 o'clock, they have between 8 and 9 to give it, or I'm sorry, between 6 and 8 to give it. Parties are given to critical medications. Right documentation. Right after you give the medication, you want to document it, not before. Okay, and you always want to make sure that you're documenting a response. The right client education. You need to know what the drug does, so that in order to explain why the patient needs the medication. The patient has the right to refuse. However, if they refuse, you have to explain the consequences and notify the prescriber that that's what the decision was. The right assessment. You need to collect any essential data before giving the medication. For example, a PT and an INR before giving warfarin, and we'll talk about that when we talk about anticoagulants, or an apical pulse before giving digoxin. Okay? Then the right evaluation. We have to make sure that the drug was effective. The only way to see if it's effective is to evaluate. Did the drug do what it was supposed to do? So preventing medication errors. There are multiple system checks. You need to ask, scan, look up the med, and check with the patient. Prescribers write legibly or electronically. If you can't read it, call the prescriber. Okay? Consult references, pharmacists, or a current drug book. Okay? Pharmacists really don't mind you calling them. I call them all the time when I had problems or questions about medications. The RN check med order 3 times before giving. You check on the computer order, you check at the Pyxis, and then you check at the bedside. Okay? Know about the medication before giving it. You need to understand why the patient is getting the medication for safety and for patient education. Okay? You need to have 2 patient identifiers, name and date of birth. Do not administer if you did not draw it up or prepare it yourself. That's extremely important. You want to minimize verbal or telephone orders. Only want to do this in a stat situation. Repeat order to the prescriber. You want to read back and verify. This is what they said. You need to spell drug names aloud so that we're very clear as to which drug it is. Then we need to speak slowly and clearly. If you don't understand, you have to ask for clarification. You need to list the indication next to each order. Why are they getting the drug? Does it make sense that they would be getting this medication? And if it doesn't, you need to talk to the prescriber about why they would be given it. Because you need to know, because you need to tell your patients why they're getting it. So preventing medication errors with communication. Never assume anything about items that are not specified in a drug order. For example, the route. If it is incomplete prescription, you don't give it. You call for clarification. Even if the only way it is given is PO, it does not matter. You still have to call the prescriber, get them to change the order, put it all in order so that it is complete. You don't hesitate to question a medication order for any reason when in doubt. Always contact the prescriber or pharmacy. Do not try to decipher illegibly written orders. Contact the prescriber for clarification. So there should not be any trailing zeros, like 2 milligrams should not be written as 2.0 milligrams because it could be misread as 20 milligrams. And then always use a leading zero before the decimal. So 0.2 milligrams instead of, say, 2 milligrams. Because it would look like, if you had 0.2 milligrams, it could potentially look like 2. So always listen to and honor any concerns expressed by the patients regarding medications. If they question the med, verify it with the prescriber. It could be that they just made a mistake. They wrote it on the wrong patient. Check patient allergies and identification. So responding to, reporting, and documenting medication errors. You want to report the error immediately to the charge nurse and to the prescriber. The highest priority is the patient status and safety. You always want to stop the infusion right away when you find out that you've given something it shouldn't be given. Complete all appropriate forms. Factual information only is very important. The med that was administered, the actual dose, and then the changes in the patient condition, if there were any. You want to document prescriber was notified and any follow-up actions or orders. You do not document in the patient's chart that an incident report was filled out. Adverse drug events helps to see trends with labs or meds. The pharmacy sends a report to the Adverse Drug Event Monitoring Program. The U.S. Pharmacopoeia Medication Errors Report Program also. Any healthcare professional can report an error. What the reports do is they really help them to see trends. My niece got an MMR vaccine, and she actually developed a measles rash. She didn't get measles, but she had the rash. So they notified the prescriber. The prescriber notified the U.S. Pharmacopoeia Medication Errors Reporting Program. They noted that there were several cases from the vaccines that came out of one specific lab, so then they went and investigated that lab and actually shut the lab down. So it's super important for safety reasons as well. So medication reconciliation. This is designed to ensure that there are no discrepancies between what the patient was taking at home and what they're taking in the hospital. It should be done at each stage of healthcare delivery, at admission, any kind of status change, if they change from like critical to stable, patient transfer within or between facilities or provider teams. So if they're going from one unit to another unit, they need to do medication reconciliation. And at discharge, this provides the latest medication list for the patient to take to his or her healthcare provider at their next visit. So this is the actual process: verification, the meds they currently use, and then clarification, review any of this information, make sure that they didn't miss any over-the-counter medications that they take or herbals or supplements, anything like that. And then reconciliation, which is investigating any discrepancies. If they're usually on one thing at home and now it's not listed on their record, why is that? And then the assessment process. Prompt the patient to remember all medications. We already talked about that. Any supplements, over-the-counter meds, allergy meds, etc. Clarify any unclear information. How often do you really take that? Emphasize the importance of keeping a current list of medications. Ethical issues, notification of the patients regarding errors. The institution and the provider are obligated to provide full disclosure to patients when an error occurs. Ways healthcare institutions can potentially avoid litigation and potentially much larger financial settlements is to apologize, take responsibility for their actions, and offer any needed financial support. Possible consequences of medication errors for nurses. Nurses may want to carry individual malpractice insurance. Make sure you obtain any written documentation of any institutional coverage provided before deciding to carry individual malpractice insurance. And student nurses should notify their clinical instructor immediately if any errors occur. And here are your resources.